Assalamu alaikum. In the name of Allah, Dr. Shaheen, thank you for giving this tough job of this presentation. Okay, all right. So, this time, usually in my presentations, I have number of colors in it. Today, I am not putting too many colors on it. Given the low resource and low middle income country, we should be slightly conservative in the colors also here. Pakistan itself is called to be a lower middle income country. So in this talk, I am going to overarching would be lower middle income countries, but I will reflect on the Pakistan aspect of it also, which is largely in the center of the whole scenario of low and middle, and we are low middle income country. We fall somewhere in between. I don't have any conflict of interest to declare. This is my conflict of interest. I work at Khan University, where I'm the vice chair for clinicals there. And this is our one of the new building, very nice building, and a lovely place to work. The scope of the talk would be that I'll talk a bit about the spectrum of LMIC to Pakistan and why health itself matters in nation's life, the challenges we are facing, specific issues related to women's health itself, role of education which can play a role in this, and some of the initiatives which are going on in these areas, and some of the recommendations which are potential recommendations. So here I would say that women's health is a cornerstone for the global health, and these are the main sort of focus points in any of the lower income or lower middle income countries which they face, is maternal health, in which morbidity or mortality comes in as the major lead ones. Nutrition would be the second bigger area. Infectious diseases comes in, and the cultural barriers which are affecting the health and access to care. These are the prime what I will focus on. We lie somewhere here in terms of lower middle income countries. Okay, why it matters? And the answer is very, very simple, that healthy women, they will drive healthy families and healthy communities. So simple as that, and nothing rocket science in that. And improve women's health will definitely going to lead economic growth, the poverty reduction itself, and social development. And if we are taking in account of the gender equality, or I would rather say equity, because equality is misinterpreted, like we can't be a male and female equal sort of in terms of itself, but it is equity, which is more important. The word, I would replace it with equity, and the health they're deeply interconnected. So if we understand this framework, we move on to look at the key challenges which have been known for decades, for donkey years. People know this. Maternal mortality, the high rates because of the inadequate healthcare infrastructure and the skilled birth attendance. So if I were to make a decision on something that will reduce the maternal morbidity and mortality, it's the skilled birth person who is delivering or taking care of women of Pakistan or any LMNC area. Infrastructure is important, but ability of a person who can skillfully take care of a mother in the process of antenatal, intra and postpartum care is the key. And somehow हल्ला इख्तियार जो हैं वो इसको वो इम्पोर्टेंस नहीं दे पाए, और ना ही हम एज ऑब्स्टेट्रिशियन दे पाए इस बात को. Nutritional deficiencies, anemia, big major chunk of undernutrition prevalent among the women. A large number of women are anemic. Infections, hepatitis currently is one of the highest infectious diseases among women in lower income countries and also in Pakistan. Malaria more in Africa as compared to Asia, tuberculosis here, and now HIV and AIDS is also surfacing quite a bit in the province of Sindh and province of Punjab and the KPK. So 3 areas are highly hit by the HIV itself. And overall, the screening of HIV in antenatal care is also being promoted, that we should seriously consider doing this. Gender norms and stigma restricting healthcare is another area, because women are pushed back and not given the opportunity to work in the area, and this is creating one major hurdle to us. And now, limited access to the healthcare, especially in the rural areas, is a major effect that is affecting the, and these are their challenges here. I'm just going to show some of the graph. This is where we fall in terms of fertility rates, in terms of contraceptive usage, in terms of contraceptive variety what we use, in terms of the gynecological and breast diseases we entail in the developing world. Humongous load. And on top, the literacy rate, in the morning also, it was being mentioned that high rates of sort of literacy has been shown. It is not clear that how can Pakistan will have 88% of sort of a literacy rate. It is non-conceivable. So stats which are being thrown at us are largely crap. At the verge of being controversial, I would risk to say that it is crap completely. In terms of adolescent birth rate, we fall very high itself. In terms of mental health issues in the developing countries, the peak zone of R is the adolescent time period as well as the reproductive time period, where largely women are being affected. As compared to men, these women are highly susceptible, and literature shows that women are more prone for this, especially in the lower middle income countries. And when we come to maternal health in LMC, maternal health rates are significantly higher. Leading causes so far remains in obstetrics and gynecology remains hemorrhage, preeclampsia, infections, and unsafe abortion. We tend to shove away the abortion aspect in the name of XYZ sort of things. Abortions are being done left, right, and center. And we have closed our eyes on it कि ये हो ही नहीं रही, या अगर हो रही हैं तो वो उसका ज़ाती मामला है. We need to look into this, the reasons and why and how we can sort of reduce this aspect. And as per solution, I would still say that skilled birth attendants or the professionals is the lead way to go, along with a good care and emergency care services. And our target for maternal mortality seems at this point in time non-achievable so far. And if we look at our projections of population, humongous rise. And we are expecting, despite all of the efforts, we will not be able to match. Same for the skilled birth attendants. Same for the coming to nutrition. Malnutrition not only affects the women's physical health, it is affecting the mental health also. Iron deficiency anemia, although the availability of iron products, especially injectables, in our neighboring country, it is kind of a norm to use injectable irons in antenatal care time period, especially in the second trimester and third trimester, which has not been adopted so far, but it is a good strategy to use injectables in the second trimester of pregnancy to combat sort of a preemptive strike towards reducing anemia in the low income countries. Education and supplemental programs. Now, supplemental programs recently, government of one of the province government has announced that they will be feeding lunch to the students. Yeah. I don't know how feasible that would be. They have started it, and if they said that if it is going to be successful, it will be upscaled to other provinces also, and also all the schools. It is a good approach, But point is, if we are feeding them with biscuits, it is not going to work. They need to be given proper food rather than the West related one biscuit with some zinc and some iron and some vitamin in it. And we fall very high in the low area. Again, just like I mentioned earlier, women are more prone to develop sort of infections biologically, and hepatitis, malaria, tuberculosis, and HIV, they need to be focused upon. Now, in terms of access to healthcare, basic healthcare, whatever the name you can change of the basic health center, you can change it. You can call it X, you can call it Y, you can keep it in the name of anybody. It's not going to change. It is what you have to give there that will change. If you are not able to give what the women need in this area, name will not do anything. One thing which over the years I have been very proponent of that long time back, we were asked to write a sort of a commentary for BJOG, and that was probably 2005. Yeah. So in that, we mentioned about empowerment of women. And yesterday, I was talking to some of the colleagues in public health, and I randomly asked them, what in your opinion would make a difference in women's health? And unanimous answer from all of them was women empowerment. So unless you do a women empowerment, it will not happen. And this is 19 years back, we, as a very starting career guy, could understand this. Why the hell the bigger picture of the politicians and the stakeholders cannot understand that women empowerment is the way to go forward to lead this crisis go away. Distance is there, cost is there, education is there, but until this comes in, and we all need to make a role in giving them power to deal with this. And obviously, community health workers and mobile clinics will make a difference if they are made available. In terms of gender inequality, access again, and early marriages and pregnancies. Now, overall, in number of places in the urban areas of different countries, early marriages is their requirement or need. If that even happens, I think if we can put a lid to the pregnancies, it will make a large impact. So I'm not a proponent of saying that early marriages should happen. Some places it may be a good strategy to behra ravi ko rokne ke lihaz se, jo hai, it is a good strategy. Yes, they should have consensual sex rather than having left, right, and center in colleges and schools. Better to be married rather than getting involved in other things. But having pregnancies is a control that should be promoted. We should focus on this rather than this aspect here. And the stigmata of talking about reproductive issues the lid need to be drawn down. Now, how successful and progress has been done? I think we all would know that a lot has been done by the agencies. Here agencies, I mean government agencies, healthcare provider agencies, the NGOs agencies. Sorry. We will know that how successful our ventures have been. Some have been there, yes, but most of them have not achieved what they were designed to do so far. I would leave this for red and yellow, green to make an individual decision on that. So to achieve empowerment, education is the key. So if anything that can be done in any LMIC, including Pakistan, is educate the women. And I think in terms of health and other places also, just like Dr. Shaheen has done a wonderful job of training midwives to a degree to empower them so they can provide care in their health. A big hand for them. Now, all these initiatives have been done. UN one, international supports, WHO programs, NGOs, government, here it is not hospital, this is health services, which is an NGO. Government programs, all of these, the aim is to get money from the international donors. मुझे ये समझ नहीं आया, इंटरनेशनल डोनर का सदका, इंटरनेशनल डोनर की ज़कात, तो हम सब लेने के लिए तैयार हैं, इस्तेमाल करने के लिए भी तैयार हैं, यूज़ करने के लिए भी तैयार है, अपनी तनख्वाह में भी इस्तेमाल करने के लिए इस्तेमाल है, अपने मैरिज के लिए भी इस्तेमाल करने तैयार है। इस बेचारे ने क्या किया है? जो लोकल ज़कात है, उसने क्या किया? जब खुलफा राशिदीन ज़कात, तनख्वाह उनकी ज़कात से आ सकती है, ठीक है, रनिंग ऑफ द सिस्टम ज़कात से चल सकता है, जो है, तो वाई कांट वी यूज इट? ये अछूत नहीं है, ज़कात इज नॉट अछूत, इट्स नॉट हाथ का मैल, इट इज द वन सॉर्ट ऑफ अ थिंग which has been used throughout the initial 300 years of the Muslim civilization to be used in the government setup. Government का काम किससे चलता था? Government के पास दो resources है, ज़मीन से कोई चीज़ निकल आए, resource मिल जाए, या ज़कात ले ले। हमने ज़कात, फिर मैं कहूँगा कि religious authorities को देनी शुरू कर दी, NGOs उनको देनी शुरू कर दी, जहाँ वो किस इस्तेमाल में आ रही है वो अल्लाह जानता है। So we need to really think and re-study what zakat is, how it can be used and where it can be used. The governments of Islam की शुरू की जितनी भी हैं, तमाम ज़कात पे चलती थी, तमाम की तमाम ज़कात पे चलती थी, तमाम लोगों की तनख्वाहें उससे आती थी, तमाम रोड्स उनसे बनते, ज़कात से बनते थे, तमाम लोगों की गर्दनें उनसे छुड़ाई जाती थी, सब कुछ ज़कात के पैसे से होता था। It was not हाथ का मैल. So why we have changed now? We need to re-look think as this the bigger donor which is sitting in ourselves. हमारे अंदर बैठा हुआ donor है. Why we have to look into these people to give their charity to us, or sadqa to us, and we use it. वो हमारे लिए हराम नहीं है. So a thought, a controversial thought, but look into this. Read yourself. Convince yourself that this zakat can be used for all these purposes. हमारे यहाँ मसला ये खड़ा हो जाता है कि MRI जो है अगर ज़कात के पैसे से आएगा तो उससे किसी और इंसान का MRI उसमें हो सकता है, नहीं हो सकता, उसमें फतवा जारी हो जाएगा. So all these things need to be looked at what we are doing. So recommendations wise are funding for government health programs need to go up. And the funding कहाँ से आएगी? Why नाम में क्या है? LMIC, lower middle income countries, हमारी income नहीं है. We need to get the income from somewhere, and the only resources are these. Strengthen the infrastructure, especially in the rural, encourage community-based healthcare initiatives, and promote gender equity. So this is from one of the article we wrote with Walraven and Marilyn, and then with our Prof. Dr. Rizvi in in best practices of obstetrics and gynecology. We have spoken about this, we have written about this. We've been promoting this agenda for a long, long time, that women empowerment need to come in. In concluding, I will say that women's health is essential for sustainable development and addressing the challenges. They require multi-sectorial approach and a collective effort. So this is kind of a model I usually suggest is, if we want to achieve, we have to have women power. Currently, we are in this mode of getting donors from all the donors which exist, WHO and अब तो WHO को पैसे भी देने बंद कर दिए, जो है Trump has stopped giving, जो है ना, उन्होंने कहा हम आपको क्यों दें, हमें अपने कंट्री में यूज करना है, हम अपना पैसा, अपनी ज़कात, अपनी खैरात अपने लोगों पे खर्च करें, हम आप पे क्यों खर्च करें यूएस पर. So इस मोड से निकल के हमें अपने नेचुरल रिसोर्सेज का प्रॉपर यूटिलाइजेशन, अपने हाँ की जो सदकात ज़कात है, इनको इस्तेमाल किया जाए अपने हेल्थ की प्रमोशन करने के लिहाज से, हेल्पिंग ईच अदर एंड टेकिंग दैट लाइफ लॉन्ग लीप ऑफ फेथ. एंड थैंक यू.
Thank you so much. I request you, sir, to please be here. I request Dr. Asif Zia to please come on the stage and give a token of appreciation to Dr. Nadeem Zuberi. तालियां थोड़ी जोर से होनी चाहिए. Thank you.